So let me begin this post by making one thing very clear. This is not an endorsement of either political party. My comments are simply a reaction to proposed legislative changes that are likely to significantly impact the way in which healthcare is delivered in this country. This past week, President Trump proposed yet another plan to lower healthcare costs via executive order by promising to allow the importation of drugs from Canadian pharmacies via a newly proposed state-by-state pilot program. As we all know, prescription drug prices in the U.S. are far higher than in any other developed country. An IHS market report revealed drugs sold in the U.S. cost an average of 56% less in other high-income countries. For decades, many seniors have ventured to Canada on organized group bus trips in an effort to find their much-needed prescription drugs at affordable prices. In fact, according to the Kaiser Family Foundation, nearly 19 million Americans illegally obtain prescription drugs from Canada in order to make their drugs affordable. That's almost 8% of the U.S. population. For example, the widely used anticoagulant Xarelto sells for around $15 a dose in the U.S., while in Canada the same drug goes for a bit over $5 a dose, and that's U.S. dollars. In the last year, we have all heard about the tragic stories of deaths in young type 1 diabetics due to rising insulin prices. Many young people have begun to ration their supplies in order to make each vial last longer, and this has resulted in death after death in many well-publicized cases. The pharmaceutical industry will argue that while they must charge these prices in order to recover their research and development costs, but I wonder, why do we have to bear the R&D costs of the world? In other countries, government is allowed to negotiate prices with pharma. We can't do that currently. In the U.S., drug makers can set their own prices and raise them whenever they want to. There's no regulation and no government interference. This allows them to make money off the backs of U.S. patients. We also really have no transparency in the U.S. Pharma negotiates prices in secret with both pharmacy benefit managers, which I've called the Sopranos of the pharmacy world, and insurers, all in an effort to line their pockets at our expense. Drug prices are not the only thing that lacks transparency. In addition to lobbying for more transparency and forcing lower prices within the pharmaceutical industry, President Trump also began the process of forcing hospitals to disclose their secret price negotiations with insurance companies now to the public. Under a proposed executive order, hospitals would have to disclose their discounted rates that they negotiate with particular insurance companies to everyone. Those who do not could be fined nearly $300 a day. Obviously, the insurance and hospital industries are very opposed to such of a change because it's going to allow us, patients, to become informed consumers. Trump's proposal would also require hospitals to disclose insurer-specific negotiated charges for almost 300 services like x-rays, outpatient visits, lab tests, or even childbirth. The price data would have to be made public online and would allow patients to actually shop around before obtaining care. Here's the bottom line. Allowing for more competition through the import of drugs from Canada simply makes good sense. If it takes executive action for this to happen, I say just get it done. The patients need it. Opponents will say that there's no way that drugs from Canada can be guaranteed to be safe and effective. To them, I simply say, why not have our FDA vet and approve several pharmacy providers from Canada and thus help ensure that prescription drugs that our citizens purchase from there are safe? We can no longer afford to be held hostage by pharma and their allies. The second proposal we just discussed that would require hospitals to display their rates and prices for tests and procedures as negotiated with specific insurers behind closed doors would be a great victory for patients everywhere. No longer will our patients simply show up and have to pay whatever the hospital decides to charge. The patients will be able to apply pressure on the market and make informed decisions about when, where, and how they want to receive their care.